poster is titled Improving Quality of Life Using an End Effector Robotic Rehabilitation Approach in Progressive Multiple Sclerosis. I'd like to introduce the presenter, Savanur Deepak Rajendra. He is a physical therapist who provides neurorehabilitation care at the Indiana University Neuroscience Center. Welcome, Deepak.
Thank you, Catherine. Thank you for having me, and it's an honor as well as a privilege to be able to be part of this, a once-in-a-lifetime virtual presentation.
We do hope it's once in a lifetime. So tell me, what is End Effector robot-assisted gait training?
It's actually a tool that's connected to the end of a robot leg where the foot would be. The end effector is the part of the robot that interacts with the environment. The structure of an end effector and the nature of the programming and hardware that drives it depend on the task the robot will be performing. So let's say in a gait cycle during a heel strike, there is a certain coordinated activation and deactivation of the muscles occurring to prepare the hip, knee, and ankle joints to be in harmony to maintain stability. Now, this coordinated movement occurs synchronously in each phase of the gait cycle, including stance phase and swing phase. The robotic ankle is programmed to mimic these movements of the ankle during these gait cycles, which in turn provides biomechanical advantage for the knees and hip to activate accordingly. So basically, when you achieve that end effector change, it is going to make a biomechanical changes in the knees and the hip and helps the person to learn walking.
That's really interesting. The subjects in your study had progressive MS and participated in 2 training sessions per week for 10 weeks. What baseline information did you have about those subjects?
Well, this was a single-blinded controlled RCT, so the person who got the baseline measurements was blinded from our study. For the baseline measurements, we used gait mat measurements including speed, step length, and the amount of weight distribution. We also measured 2-minute walk test, endurance walking for 2 minutes, and we also used the Borg scale for measuring the endurance. Among the quality of life, we used modified fatigue impact scale and the multiple sclerosis impact scale 29. Those scores were measured as a baseline. The time duration from which the patients had MS ranged from, recently diagnosed about 6 months to patients who had the diagnosis close to around 20 years.
Did you look at EVS scores in these patients?
We wanted these particular patients or population to have some amount of gait issues. And what we kept as an inclusion-exclusion criteria was EDSS 4.0 to 7.0. Our average, as we tested our subjects, the EDSS was 5.5 for all those patients which we have studied so far.
Great. Okay. Now, your gait training program showed improved walking speed in these participants. Can you tell me a little bit about that result?
Yeah, that's a great question. And what we found out is the gait speed increased significantly for all the population or patients we studied. And along with that, the progressive patients were able to tolerate more and more of these exercise programs. For example, they started off at sometimes like 10 minutes of this program, and by the end of it, they were able to do 30 to 40 minutes of this program without taking or with very minimal breaks.
Okay. Is there a way that these types of skills, for example, increased walking speed, can be transitioned to work that a person can do at home?
Yes, obviously, what we try to do is in the front end try to load them with this capacity, which they might have not had before. So we usually give them a good walking program in their community or in their home. It could be like their gym, or it could be in their home environment safely, where they can hopefully maintain what they have gained from our program.
What kind of comments did you receive from participants when they were working
Oh boy,
with technology?
yeah. Well, initially some of them were very hesitant because it was a novel idea, and some of them had not ambulated more than a few steps at a time. It took some learning for them on the robots to start walking on it, but overall it was a very positive experience. And in fact, some patients actually looked forward to coming to PT compared to dreading it previously when they used to go for a conventional therapy.
This has been very, very interesting conversation, and I really appreciate your participating in the interview.
Thank you so much, Catherine. I appreciate it, and thank you for your time.